So in that case, I have done my own planning. Although the CBCT center provides me the data, as the oral surgeon, I am performing the case. I always go double check. I always plan the measure my own measurements, and accordingly I plan the case. So in this case, first slide you will see that the bone is around 5 to 6 mm. Hmm? And length is around 14 mm in this image. So in these cases, as the bone is less, the conventional implant, if we place, it requires bilaterally 1.5 mm of space. Buccally 1.5 mm, palatally 1.5 mm, and in between implant is placed. But you go with the measurement, if it is only 5.6, then we cannot place implant, because the least size of implant available for conventional implant is 3 mm. So we cannot go beyond that. But in cases of basal implant, it uses a technique in which we go minimum drilling. So the last drill to be drilled is the first drill. That is around 2 mm or 2.5 mm drill is only required. Hmm? And length is around uh, one is only around the apical area of the that teeth, and that too because of the pneumatization, the bone available is less. Hmm? Similarly, the variation on the buccal side and side is there of the bone. This is the anterior central incisor. In that, only apex lies in the bone, tip of incisor, and the bone is almost thin everywhere. Okay. So in these cases, you have to only go for basal. With the help of my measurement, I will go that on right side 43.1 mm and on left side 41.9 mm is sufficient. Although I have to go for concavity is more, I have to go for palatal approach, uh, but the palatal approach becomes prosthetically managing difficult. So I, in that case, although concavity is there, I can manage it with the extra sinus technique. And on right side, it is almost extra sinus, no concavity, severe concavity is there. And because of that, I have completed my case, and I have completed my case from extraction to the prosthesis delivery within 3 days, because the in cases of basal implant, we don't need a very much longer time to load the prosthesis. hmm, because in that immediate extraction, implant placement, impressions, all taken care of. Okay. So this is my case too. In this, I have gone with the zygomatic implant. So, similarly, on right side there is 10 to 11 mm of bone is present, zygomatic bone thickness, and on left side similarly 10 to 11. So this is the minimum optimum length uh, thickness of bone available to rehab. So this was the pre-op. You can see the anteriorly there was bridge, and right side there was also bridge. But hello, patient है क्या? So similarly, you can see there is less bone available, alveolar bone on all these slides, and the tooth were severely destroyed, decayed, on both buccal and both mandible and maxillary area. Thinning of bone is there. both side around 6 to 7 bone is also there. In some cases, it is around 4.56. So similarly, I have planned by the basal implant placement technique. So this is the pterygoid implant. Hmm. So this is how I plan to place a pterygoid implant. From measurement, I have known that it is around 14.5 and this is how I done the case. In that, I the patient refuses to get a implant done on right side even after counseling. So I have done with the rest of the side. In that, I have placed an implant on the left zygoma, pterygoid implant around 18 uh, somewhat deviation from the previously planned sizes. Okay, and place an implant in the maxillary anterior region, palatally, buccally engagement, and in mandible also, and done with the intraoral welding technique. And after that, I have given taken an impression and done with the prosthesis. In similar way, you can go with this. Okay, so this is the my presentation. I'm not now hand over to you, sir.
Yeah. Thank you so much, sir, for a wonderful presentation and knowledge gaining this webinar. We have a few questions. Please go for it. Dr. Abhay Kulkarni had asked, taking help of basal implants, can we reduce the number of implants to be placed?
No, sir. In cases of basal implant, you have to go for multiple implant placement. Even you have to replace a single molar in the maxillary or mandibular area. You have to place a two implant because it functions on the principles of osteofixation. That means similar to the orthopedic surgeons, they have placed if you have fracture, they will and it cannot be reduced easily. They will place a K wire, Kirchhoff wire. So similarly, from that orthopedic phenomena, we get to know that we can similarly place in case instead of wire, we can similarly place a screw into the mandible or maxilla, and with the help of that, we can rehab the area because that implant is placed in the basal bone. That basal bone is that bone which is does not undergo resorption with the time. So bone might undergo resorption, but basal bone doesn't get resorbed with the time. So we get encouraged into that area. So you have to go with multiple implants. In cases of mandibular full mouth rehab, you have to at least place 8 implants. And in cases of mandibular maxillary rehabilitation, you have to place at least 10 to 12 implants. And you have to also check for the zygomatic and pterygoid implant placement because only 8 implant or 10 implant placement in maxilla does not guarantees the success because most of the patients we do basal implant is with less severe maxillary atrophy. Patient is diabetic, patient is hypertensive, patient ignored rehabilitation for most of the time. So if such cases encounter, we have to not only compromise with implant number. Okay, you have to place 20 implants for full mouth rehab also. Okay, so this that is the landmark. Okay.
Okay, so next he asked, can we use combination of basal and conventional implants in edentulous jaw?
Yes, in some cases, if the conventional implant is already placed in one of the arches and you have to rehab the another arch, you can place the basal implant also, or you have to planning to place that. You have to very go with conventional implant, but conventional implant should be immediate loading. Okay, so there is newer implant technique is there in two-piece or conventional implant that is immediate loading. So in that immediate loading implant, the threads of the implant are aggressive, and as in basal we engage the basal bone. Similarly, in that immediate loading, they also engage the basal bone. Conventional two-piece implant. So you have to plan accordingly. You have to go for conventional. You have to go for immediate loading along with the basal because if you load maxilla first and mandible is left for 3 months to osseointegrate, then there will be no function for patient to chew in that period of time. So we can do it, but with immediate loading protocol in conventional as well as basal.
Okay. Next question is from Dr. Pratik Parkarwar sir, who is MSDC representative also. When to go for basal implants? How to decide it?
There are two or three criteria that will decide the basal implant. First, the width of the available alveolar bone is less than 5 or 6 mm. So in that cases, conventional implant cannot be placed. And if placed, there is a risk that there is resorption of the cortical bone, buccal and palatal cortical or lingual cortical bone, and that will in later stage will expose the implant threads into the soft tissue. So in that cases, normally we avoid implant. In such cases, you can place basal implant. If the patient has a systemic condition, patient is diabetic, patient is diabetic, hypertensive, and the patient is severe periodontal compromise. In that cases, we advise for full mouth extraction and place a basal implant. And in cases where you cannot go for sinus lift, conventional direct indirect sinus lift, but you have to rehabilitate patient early, then you can go for basal implant.
Okay. Thank you, sir.
Yes, sir.
Sir, one question is from my side. I want to ask a question. Any such a rule is there that if we are doing basal implant, so when conventional implant fails, only that time we have to do basal implant, or any case we can do? Like
Sir,
the
the
reason for
indication of
basal
basal implant is
implants, bone is less. That is why we go for
if the
basal
bone
implant.
is less, is
Yes,
there is severe maxillary atrophy, bone is less, or in cases patient has a systemic, you can go with basal. But if you have to go first with basal, then you can go with immediate extraction cases. It has a wonderful result in the immediate extraction cases. You can immediately extract the tooth, immediately place a implant, immediately take a impression, or within 1 to 2 hours you can give provisional prosthesis, or within 3 days you can give final prosthesis.
yeah.
So
So
this is the
my
beauty
question
of
is, sir,
basal implants.
yeah, I got it, sir. My question is, sir, when we are doing basal implants, so if conventional implant is possible in that case, but
Yes.
still we are doing basal implant, is it fine?
No,
Even if
sir.
bone
I
is there,
usually prefer if sufficient bone width,
yes,
length is available, patient is well
ready
versed
to
with the
wait,
conventional
yeah,
protocol, then I will go always with the conventional implant. If the
correct,
conventional implant is failed or bone is
yes,
not there, then I will go with basal implants.
yes, that's what my question. Thank you, sir. Thank you for answering.
Yes.
So, any more questions, sir? Yeah, I'm checking, sir. So Dr. Pratik Parkarwar, sir, thanked you for answering. And Dr. Abhay, sir, is not there. I will uh, provide your information to him.
Yeah, I'm there,
So,
Sudhir.
there is appreciation from Dr. Tejavati. Good presentation, and thank you, sir. Dr. Deep Jyoti Mudgade, she also appreciated. Very nice presentation, sir. From There is a one question from senior faculty, Dr. Smita Chopade, ma'am. What if we hit the base of the maxillary sinus and puncture it during placing implant?
Yes, yes, ma'am. We routinely enter the sinus. We routinely puncture the sinus. But the beauty of the basal implant is that it has a smooth surface. There is no rough surface. We call it as bicortical implant or BCS implant. So even if it punctures the sinus or even if it is with the contact with the sinus, there is no reaction because there is no roughness for the microorganism to attach to the implant and causes a this foreign body reaction or infection or any other cases scenario. So this is the beauty of the basal implant, but the condition is that you have placed basal implant in a basal bone and you get a very good torque. Even that cases you can successfully do the case. Even you have punctured implant or even your implant is processed through the sinus, it is fine.
Dr. Shraddha, Dr. Tejavati, thank you for the webinar, sir, and all the questions are answered. Uh,
I
anyone,
think
if
you finish it up now, Sudhir.
yeah,
Wind up now.
okay,
Give
sir.
a vote of thanks to all. I'm thankful from MIDSR Dental College to all the attendees, the MSDC observer, the speakers also, and to the ADCs. It's over to you.
Yes, sir. Uh, on behalf of Dr. Abhay Kulkarni, sir, and everyone, I thank both the speakers, Dr. Mahendra Patait and Dr. Venkatesh Hange, as well as I thank Principal Sir, MIDSR Dental College. I thank today's representative, MSDC representative, Dr. Pratik Parkarwar, sir, for the second time. Thank you, sir, for taking care of the MSDC. I hope everything was fine in the coordination and organizing this webinar, as well as thank you everyone who attended this webinar. Thank you, Dr. Venkat, sir, for your knowledge sharing. It was a wonderful webinar and a lot of knowledge
Thank you
sharing.
giving me the opportunity to share my knowledge with my colleagues. Okay.
Yes, sir. Pleasure, sir. So thank you everyone and have a nice Saturday evening in your clinic, everyone. And thanks all the senior faculty for attending. Dr. Smita Chopra ma'am and other faculties. Thank you so much, everyone. See you in next webinar. We have a webinar of Dr. Srujan Magar on direct anterior composites on 30th November. And other webinars are also lined up. All information will be provided in the WhatsApp group. As well as if you have any more questions, queries, or discussions, you can put in the WhatsApp group. The mentors will take care of it. Thank you for attending, everyone. Let's end up the meeting here. Sir, should I end up the meeting?
Yeah, finish it up, Sudhir.
Okay, sir. Congratulations to you. I
Thank you.
hope you are attending the event now. Okay.
Yeah.
Okay.
Peaceful.